Greetings and welcome to Maisha Kazini. So SHIF has been implemented, it has been rolled out. Of course, it has caused much grief and chaos, but this is what the government does. It plans things badly, it doesn't communicate because it fears that we might change their plans. And then when they implement and it causes chaos, they cynically decide that those people are the cost of change. And if we have to sacrifice them, so be it. What is so difficult for me watching this whole scenario is that all the things I want about CBC are being replayed with SHIF. So even the cost of people who will not get medical care, who might die, is the same cost we decided to pay with the first 3 years of CBC. We decided they don't have to learn while we wait for the KCSE children to finish high school. And then now we will get the grade 9s into the system. And then, so what if they haven't learned for 3 years? It's the cost we have to pay for change. In other words, those people who become the cost are not human beings. That says a lot about the way the government thinks of us. They don't consider us human beings. Their job is to implement policy. And that's why I really hate that word. Because the people who talk of policy never think of people. And most of all, because they despise the arts and the humanities, they are unable to think of what do things mean for real human beings in real time. So that's where we are with SHIF. Now, as I've been listening to the conversations, there's been one thing that has frustrated me, which is that, okay, I get the technical reasons why SHIF is not working, but, what's the goal for society when SHIF is being planned like this? And what does it mean going forward? These are the questions that educators ask, because as we look at things in terms of generations, not just in terms of the present. So I'm not going to talk about the fault lines of SHIF and what's wrong with it. I'll recommend instead 2 conversations, one on the Lynn Goge show with Dr. Mundia, which is a fairly good overview of what the problems were with NHIF and the problems with the rollout into SHIF. And then I'll also highly recommend the X Space, which was held by Boniface Mwangi, which also looked into those details. And I will put links to those 2 conversations below so that you can listen. In this video, I'm going to ask and answer the educators' questions. What does SHIF mean in the long term? And what values are underlying SHIF that it can be promoted this way? So, karibuni. Like I said, I had a number of questions which were not quite being answered by the conversations about what is technically wrong with SHIF until I listened this morning to the talk by David Ndii about why they decided to roll out this system. And from his speech, if you're not paying attention to the philosophy, the values underpinning what he's saying, it sounds fairly legit. What he says is that we had a healthcare system that was based on the salaried or the employed. And even when it was being extended to the people who are not employed, in his view, they didn't have the discipline to keep paying their contributions and would only remember about paying when now they needed healthcare. And usually when they were seeking healthcare, it's usually when they had diseases that were at an advanced stage that became expensive to treat. And yet if they had seen a community health officer or gone for a checkup, they may have detected these problems in good time. That sounds fairly logical. So I'm going to talk about what I find the problem with that kind of reasoning. I think the first troubling thing about what he was saying is his attitude towards the poor. I mean, okay, maybe people don't remember if they're not salaried to pay NHIF contributions until they are unwell. But to assume that what they need is rescuing by the people who are salaried and forced into SHIF, and then to use this thing called means testing, which is something that needed to have been discussed because it's a solution from elsewhere. To think that that's the way to go and to have bureaucrats and civil servants invading people's homes, taking records of what they own and what they don't own, where are they getting water, do they have livestock? That is such a dehumanizing and intrusive way of implementing a health policy. And this is not simply about solutions, because according to him, Kenyans are burdened with healthcare costs and they cannot produce when they are sick. True. But they also cannot produce when you're humiliating them like that and making them feel less than citizens, that they have to be treated like children by the civil servants invading their home. Was there any study showing why people can't remember to make their NHIF contributions? Because even as an anthropologist or a psychologist would have maybe suggested something. Were they asked, how come they forget? Because you see, if you're a farmer, for example, you're working with the seasons. You're not working on a calendar month basis. So it's understandable if you're not thinking of NHIF contributions on a calendar basis. For people who are salaried, they get their money at the end of the month. So they would remember, even when they're not employed, they would remember that they need to pay their, like if it's a business person who is paying bills at the end of the month, they would remember to pay NHIF. So we are comparing apples and oranges. The way we think of time and the way we think of society is different. And you see, that's what education is supposed to address. So to assume that farmers can't think of making contributions every month, so let's help them invade their homes and tell them how to pay SHIF. That's so patronizing. And ironically, he calls us, the people who are asking questions, he calls us patronizing. It's extremely patronizing to think that since people who are not salaried don't remember to do this, now let's intrude your homes and show you. And this attitude towards other Kenyans, that you diagnose the problem and you don't consult and then you impose the solution. To me, that's the problem of technocrats. And I've complained about this before. The fact that you have an education and that you can read statistics and all that, it doesn't mean you know everything. And whatever decisions you make must still be subject to democracy. People have to say what they think about those ideas. So I think one of the problems of our education system is that it makes technocrats feel that their job is to invent solutions. And that's why I've been so against this idea that our job in the education system is to teach people to solve problems. Problems have to be solved by all of us, whether we go to school or not. We need to talk because those solutions are going to affect everybody. So everybody has to be involved. So that's a very patronizing way of seeing the problem of contributions. The second problem with his ideas is that he sees economics as the main lens through which to look at healthcare. I find that very sad, but very understandable because it's a Kenyan thing. Kenya is a very neoliberal country. We don't know how to read life that falls outside of science, antenna biomedical science and economics. So telling these bureaucrats especially that our values matter, our dignity matters, that doesn't register in their radar. So for him, he's looking at healthcare as going to hospital when you're sick. And yet healthcare is so much more than that. For example, in fact, when I was listening to him, I was thinking, there are some diseases which we wouldn't be getting if we were not stressed. I mean, look at when the rollout of SHIF happened. There were so many things going on. There was the impeachment of Gachagua. Then there was the report about this young man who was so brutalized in Mombasa. And then I can't remember what the third thing was, but Kenya is such a gaslighting country. We can never stop, catch a breath, and find life at the same place because there's so much theater, gaslighting, and threats from the government. How can we be healthy in such circumstances? And then you look at a place like Nairobi, there are no green spaces unless you can pay for them. Even Uhuru Park now has been closed. So if you work Monday to Saturday, where are you going to relax with your family if you don't have money? And even that Uhuru Park is on the other side of Uhuru Highway, meaning that if you live on the other end of Nairobi, you still need bus fare to come to Nairobi to relax in the park. I think we are not serious, and we need a better view of healthcare other than when we go to hospital. So this SHIF, maybe he would argue that his concern is the money spent on the hospitals. But what about the other things that we need? We need green spaces. We need a less stressing life. We need more economic opportunities. We need less corruption. We need safety. I mean, look at people being sexually assaulted. How can we be healthy in such circumstances? So the thing about this SHIF thing, yes, it's about hospital care, not healthcare, hospital care. It's about hospital care, but it's not taking into account that the larger society also has to change if we are to spend less on healthcare. And maybe that's why people don't even remember to make their contributions. If you're a farmer and you don't know when you'll be paid next, how are you going to make NHIF contributions every month? So you see, there needed to be sociologists, anthropologists, psychologists, ordinary people. He should have asked them why they are not paying NHIF. But to decide, oh, they are not paying, now we are going to do means testing and we are going to force salaried people to pay more. That is so presumptuous. And we were not given the opportunity to look at that kind of reasoning. The other assumption that is a bit problematic that he makes is that it's the role of the state to order society. The logic of this SHIF, which is what he articulated and what Mwende Gatabaki also thinks, is that if you can organize everybody's data under the government, then the government can make better decisions about us. I really dislike that assumption, that the state can provide solutions because the state cannot think in multiple ways. You see, even what I'm saying, that we needed multiple views like culture, behavior, society. The state cannot think like that, and usually the government is very hostile to multiple ways of seeing. So to think that the state can be the only solution to our problems, that's so messianic, and we should have been given an option to talk about what our dream healthcare would be. And I'm not convinced that the state can offer healthcare. I've said the same thing about education, because the state is fundamentally flawed in its philosophy. The Kenyan state is focused on foreigners. Its job is to implement foreign policy. And in fact, one of the things that I had a problem with listening to doctors was when they were saying, yeah, you know, we have a good vision of what we can have as universal healthcare, but who are they quoting? They are quoting World Health Organization, and they are quoting SDGs. Those things are so problematic. So you see, even you wonder, why are we not studying the arts in schools? Because we need to be critiquing some of these policies. Are they pro-African? Why are they necessary in the first place? Do they take care of our problems? What about us? Is it that we cannot come up with our own solutions? So this reliance on technocrats and foreign ideas is part of our governance problem in Kenya. So generally, from what he was saying, what do I see the issues are? One is that he's imposing remedies from above and then telling us that that is bottom up. And you know what? The even funnier lie about this thing and about Kenya Kwanza in total, they're imposing things from above and then telling us that that is bottom up. And even worse, they are calling that socialism. I mean, this SHIF is not socialist at all. It's only socialism for the salaried. Because all the other people, they have to do this means testing, which is so, it sounds like the welfare policy in the US, and you know how racist that thing is. It's going to be humiliating. It will be indignified. Will people want to tell the chief all their property? Will they want somebody to snoop around in their homes and say, oh, you have 10 chickens, that means you're worth this? Does a person have the ability to appeal against that judgment of their property? You see, if it's a socialist system, if we are having social health care, everybody should be attending public hospitals. But as we know, politicians are still getting private healthcare insurance, and who is paying for it? It's all of us. It's so cynical, and I'm later on going to talk about the politics of cynicism. This is a very cynical policy. But you see, the thing is with Kenyans, we don't like anything about attitude, emotions, ideas. We say that that is irrelevant to the market. But we don't see that cynicism has a very material effect on us. So that's one issue, that this is a lie. We are being imposed on remedies from above, told that it's bottom up, and then it's called socialist. That's a joke. This thing is capitalist as hell. It hasn't changed. Then the other annoying thing about what he was saying is that he thinks that the state works well. So he's thinking, if we impose this policy, and which is what those advisors in the health, whatever, are thinking, they're thinking if the policy is good on paper, then it is good in reality. Come on. What naivete is this? That's not how life works. And remember, I've been saying our education system teaches us to avoid reality, which is what they're doing. So they're making a good policy that sounds on paper, but this is Kenya. But more than that, he's only talking about the middle class and the poor, but he's not talking about the rich who are looting from our economy. But you see, he told us that corruption is not an agenda of Kenya Kwanza. So you see, it's off the table. What the rich are getting from the looting from Kenya, the pay they get from Kenyans, the healthcare they are getting from Kenyans is off the table because corruption is not on the agenda. I mean, this is a very Cinderella type or messianic type of thinking about the Kenyan state. The Kenyan state is colonial to the core, with madharau for human beings. That hasn't changed. The other thing that he says is that the problem of our economy after the independence was that we believed in trickle-down economics. What is trickle-down economics? It's the idea that if you let the rich make money, eventually the some of that money will sort of flow down to people. Maybe not in big doses, but at least it will flow down to people. The rich will employ, they will give donations, they will build it through charity. So he was saying that that's the model of our economy. I want to say that I completely disagree. Our economy was a neo-colonial economy. We were not doing trickle-down economics. Trickle-down economics is for the West. And maybe in the World Bank documents, they were prescribing trickle-down economics for Kenya, but that's not what the Kenya economy is. Our economy is a feudal neo-colonial economy. And so in the rest of this video, I'm going to talk about that, how I see the Kenyan economy, although we talk a lot about it on this channel. And then I will also talk about what I think it means in terms of why our healthcare is being ordered like this.